February 18th, Tuesday, noontime is my appointment. Walked down the stairs, through the parking lot, through the main lobby, and I think I got as far as the gift shop. My heart stopped. I went into sudden cardiac arrest, and I collapsed to the floor.
I was working as the senior resident in the medical ICU, and I heard the code blue called overhead. So the medical ICU is on the 4th floor of the Daily building. So fortunately, I was able to respond very quickly.
And when I had no symptoms, I felt no pain, nothing. It was like they flipped a switch and down I went. And from then, I don't remember anything.
When I arrived, Stanley was already on the ground, and high-quality chest compressions were already in progress.
I was pretty close. I was like right around the hallway there on the 3rd floor in our office. Stanley did not have a pulse at all, which medically that's about as serious as you can get. We put Stanley onto the monitor, and we found out that he was in a rhythm called ventricular fibrillation.
Without prompt intervention, this kind of abnormal heart rhythm is fatal. And usually it's fatal within a matter of minutes. As the first physician to arrive at the code, I announced myself as the code leader. We connected Stanley to the cardiac monitor.
We were able to immediately defibrillate him and get a pulse back on him pretty quickly. We got there and I just looked up and everything was there that we needed. The code cart was pulled in, a stretcher was there. We had security was blocking off other people from coming around so we could try and have some privacy for him as well. It was really a great team response.
Even before we transported him to the ED, we were in touch with the physicians in the emergency department, so we were able to ensure a very smooth transition of care from myself to the ED physician. Probably less than 3 minutes to get from the hallway in front of the gift shop to the emergency department.
They said he was stabilized and they were putting the stent in. All the staff and the doctors, nurses were absolutely wonderful. They helped to ease my anxiety and my worries. We stayed the night with him, and they took him off the ventilator later the next morning.
By Sunday, they had sent me home. And then I had started having twice a week physical therapy and a visiting nurse for like 4 or 5 weeks.
Just the fact that he came in just for a procedure and happened to go into cardiac arrest right there in the lobby, and that was not his time. And I'm just so thankful that we were able to help him.
Everyone really stepped up and did everything that the patient needed to have done.
I would like to thank them from the bottom of my heart, because that's the part that they fixed. I love to tell them how much I appreciate what they did for me, giving me these extra days to spend with my family, friends, my 2 dogs, my grandson. Thank you, thank you, thank you.